everyone, welcome back to another episode of Let's Talk For Real. And today we have Dr. Moses with us again. So today we'll be talking about anesthetics, and many pet parents we know are worried about putting their pets through anesthesia. And today we'll be discussing about anesthetics for your pets so you can make a more informed decision. So Dr. Moses, for our listeners who may not be familiar, could you briefly explain what anesthetics are and how they work in pets?
Okay, so I think to better understand anesthetics, first disclaimer, I'm not anesthesiologist, specialist kind of thing. But anesthetics in general, we have a few different classes and they're used for different purposes. I think the one where everyone is, I suppose, a bit more familiar with would be general anesthetics. So things like isoflurane, the ones that, we put your animal under the gas kind of anesthesia. But actually things like your sedatives also. We have local anesthesia as well. If you get wisdom teeth extractions, they give you those injections. Certain anesthetics are also used to treat things like seizures. So seizure medication is a form of anesthetic as well. It's just that how much we give and the effect that we're trying to get is a bit different. Yeah, so I think anesthesia generally is a form, to really simplify, is a form of chemical restraint of animal using chemicals.
So let's talk a bit about pre-anesthetic considerations. So what pre-anesthetic checks are typically performed on pets before surgeries or procedures that require anesthetics?
So at the baseline, it's always a physical exam. And usually we also prefer to do some sort of blood biochemistry and hematology as well, depending what we are trying to do. Most often, it will be, or rather, the recommended will be physical exam first, and then your blood work at the same time, so that we have a clear picture of how your pet is doing in general. So if your, physical exam picks up a heart murmur, you'll be like, okay, maybe it's not so, we need to adjust our anesthetic protocol, or maybe this is something we want to investigate further first before we consider, anesthesia. If, say, you're planning your cat for a spay, or your dog's dental, that kind of thing. Something that maybe we can pause for a bit. Of course, if it's an emergency situation, that's different lah. But I think if we think about planned procedures, that's definitely what we would do. We recommend, okay, we find anything abnormal, any sort of abnormality we find, we would want to investigate further, make sure the pet is stable, ready to go for anesthesia. So that's why also the blood work comes in. Your biochemistry, we look at kidney function, liver function. Is it able to manage, the effect of the anesthesia on the body? Is it able to process properly? And then things like your blood cell count. Is your pet anemic? Is your pet, what we call thrombocytopenic? So are there enough platelets? So say you're doing a spay, you want to make sure that one, there's enough blood, two, the blood can clot properly, or the white blood cells, is there ongoing infection as well? Because the moment you put your pet under anesthesia, the immune system will drop, right? So if your white blood cells are already low and then you put the anesthesia, it gets even lower, your risk, it could, two situations are. One, maybe it genuinely is healthy, but then the moment it goes under anesthesia, the immune system gets worse and then it falls ill. Or two, it is ill already. It's just that it's not at the point where it's showing a lot of signs. So most of the time, if we do see all these changes, then we will say, okay, let's investigate further, with this information we have. Let's see what's going on. Let's try and manage everything. Maybe if the surgery can be postponed, or, you can wait a few days or maybe a few weeks, depending what the situation is, then probably it will be the most prudent thing to do. We wait, we treat what we need to treat, make sure animals back to a good, healthier state, a state that can tolerate the anesthesia better, and then we do the procedure. Yeah.
Would you recommend for planned procedures that, if possible, to always do blood works before the anesthesia?
Definitely. I would definitely recommend that, because there's only so much. I mean, a good physical exam will tell you a lot, but internally, unfortunately, there's not a whole lot I can tell you just from a physical exam. The blood work is there to supplement our findings. Also, sometimes we're like, seems a bit off, but actually we check, everything is fine. Sometimes we are worried about something, but based on the blood work, we become a bit more confident. Okay, maybe this is just something we don't need to worry about, or it's not as big a problem as we thought. Or sometimes if say it's a procedure that we have to do despite say the dog comes in with pyometra, we can decide how we can stabilize your pet first to prepare for the procedure lah. At least in the few hours that we have, depends on the situation. At least we can stabilize first. We know what we need to do, or how we can support your pet better before we actually do the procedure lah. Yeah.
And I'm sure any of us that has brought our pets for any procedures that requires anesthesia, like especially for dogs and cats, we would have the clinics tell us that, you must fast your pets how many hours before that. So what are the typical fasting guidelines and why is it so important?
So I think the big thing about fasting is to prevent one of the complications from anesthesia, which is vomiting lah. So, or rather, when they vomit, they don't end up vomiting. Either they don't have a lot to vomit, they have nothing to vomit, or two, it's a lot less lah. The reason for that is when they vomit post anesthesia, right? Their airways they're not conscious enough to protect their own airways, And even if they are conscious, the risk of breathing in what they vomited is also high. Then you get aspiration pneumonia, which can eventually become life-threatening, and it is quite a serious complication of anesthesia. So this is one way we try to eliminate that. There are different guidelines based on the type of patient you have as well. There are certain species that should not be fasted. There are certain species that should. And also life stage, physical, any pre-existing conditions may also change the recommendation lah. And also sometimes there are guidelines, but there's also what is practical lah. So say for example, if you're fasting, your fasting time is about 6 to 8 hours, then if say your procedure is at 10 a.m. in the morning, it's a bit unfair for me to tell you, wake up sometime between 2 to 4 a.m. to remove all the food and water lah. You might actually forget, or you might be too tired lah, So a lot of times what is recommended is what is also practical lah. There are guidelines. And I suppose in the ideal state we try and do it we try and follow it to the best that we can lah. But sometimes we may not be able to for whatever reason. Sometimes say the pet parents also forget, then we rather give you a recommendation that you can definitely follow and we know will be safe for the patient lah. So like generally about an 8-hour fasting period, 8 to 12, we do for higher risk of vomiting. That range does vary a bit lah. But generally about 8 to 12 for higher risk of patients that are at higher risk of regurgitation or vomiting. Yeah, that's what we would recommend. But also on a practical note, it's easier to tell you, remove all food at midnight. So it's kind of about, by the time you come to the clinic, it's somewhere between 8 to 12 hours lah, So it depends what time you sleep lah. But generally about midnight, it gives you about 8 to 12 hours already. Yeah. Of course we don't. The consideration is we also don't want the animal to go without food for too long or that kind of things as well lah. So sometimes pet parents do also, they pre-board their pet, and then the clinic can help. If it's a 24-hour clinic, they can actually help with the fasting at the so-called the most accurate interval for that patient lah. Yeah.
Okay, so what happens during anesthesia?
So for anesthesia, right? So essentially you're using medication to create a state of unconsciousness or inability to respond to external stimuli lah. So for anesthesia, for general anesthesia, that's what we aim lah. Of course, you have anesthesia and you have pain relief as well. Slightly different things, but anesthesia means that the animal is in a state where it cannot respond to you. It does not necessarily always mean you cannot feel it. That's why with whatever procedures we do, there's also pain relief on board lah. It's not because we just want to add more medication, that kind of thing. some of the anesthetic drugs also have a bit of pain relief effect as well. So we kind of use things in combination. The whole point of, I suppose, putting an animal under anesthesia is to render them unable to move to allow us to do whatever necessary procedure that we need to do. So, for example, dentals, I think it may seem like, why I need to, why does the animal need to be under general anesthetic, right? But if you struggle to brush your dog's teeth or your cat's teeth, I suppose you think about it. Will you get very far with a very loud instrument that needs to break down plaque and tartar in the mouth? Or if you need to extract teeth, it's not going to sit there nicely and let you extract the teeth conscious, right? So you put them in that state, but it's controlled. It's not like we knock your animal out and then it's unconscious now. It is meant to be controlled. So anesthesia, we can control the depth as well. Depends what the medications we're using as well. So inhaled anesthetics are often quite good. They allow more rapid adjustment of the anesthetic depth as well. So it allows us to get them to the what we call surgical plane of anesthesia, where we know they're not going to move. We know that we can do whatever we need to do safely, but it's not so deep that we have an issue recovering them as well. Yeah. So that's kind of what happens during anesthesia. We kind of we try and get them to gradually fall asleep. Of course, for some, there is also an individual variation and other factors that affect how smooth that process goes. We want them to fall asleep very smoothly and then wake up very smoothly as well. Yeah.
So I guess a lot of one of the big questions in pet parents' mind are, what are the potential risks and complications associated with anesthesia? So
with general anesthesia, same. I suppose if you yourself have been under general anesthesia, the doctor would have gone through, there's a risk of death, there's a risk you go under, you never wake up. I think that is one of the most commonly heard ones. And I think your regurgitation post-anesthesia, some animals are more sensitive to certain medications or anesthetic drugs that may result in, a bit more serious side effects that perhaps are not so commonly seen as well. But most common, I suppose, risk is one, they die, right? Death under anesthesia due to anesthetic complications. 2, regurgitation, and then anything and more drug specific reactions or adverse effects as well. Yeah. But I suppose the 2 most common, the 2 that we tend to brief more about would be death under anesthesia and the regurgitation. And I suppose if you're using inhaled anesthetics, the intubation itself can also bring about some airway irritation as well. And of course, some of them don't wake up. They take a longer time to wake up as well. Yeah.
So how often do complications happen?
Depends who you ask as well and what kind of patients. But I think in a very general situation where it's elective procedure, say like a dental in a otherwise healthy and average age healthy animal, then we're looking at you understand the risk of death under general anesthesia is generally agreed upon to be about 1 to 2%. So it is low. And we also have situations where sometimes a patient is not the most ideal patient for anesthesia, needs anesthesia, then we manage it accordingly as well. But yeah, sometimes the risk can get higher. But in most healthy patients, it's about 1 to 2% for risk of death. Regurgitation depends. If you don't fast them, of course, your risk is much, much higher. Chances are they will, waking up from anesthesia, if it's will it be prolonged or will it be fast? Part of it depends on the animal's condition as well. If it's healthy but it's a bit overweight, it might take longer. If it's very stressed out, it might, wake up and be very, what we call dysphoric. So you look very it's like freaking out, So there's some individual variation to it as well. Yeah.
So what are being done to minimize risk during anesthesia?
So first and foremost, our pre-anesthetic checks. So health check, either a day before and on the day itself. On the day itself, we will minimally do a physical exam. if blood work hasn't been done recently, then we would try and do it same day. Ideally, everything on the same day so we have the most accurate picture. But sometimes, a day before, 2 days, sometimes sometimes even up to a month if nothing has changed. You can, with some confidence, accept those results as well. But usually, we try not to stretch it too far. If there are any issues, then we try and stabilize first. Like even in an emergency, say an emergency situation, we don't going to anesthesia is not our first go-to lah. It's always stabilize first, unless there is no choice, But usually you will have a small window to at least stabilize your patient first, and then prepare for the procedure lah. Or prepare for anesthesia. Yeah. So in terms of if it has a heart disease, then we change. Or heart disease, liver disease, kidney disease. If the procedure is not absolutely necessary, then maybe we manage first before we plan for the procedure. Or if it is something that is urgent or something that has to be done, then we adjust the protocol. So anesthesia is not, there are so many different anesthetic protocols, anesthetic drugs. You can use them at different doses. So doses will be adjusted according to what the patient needs. The type of drug used as well. Yeah.
This podcast is proudly sponsored by Hill's Prescription Diet. Is your pet's digestive system giving them the blues? Loose stool and other tummy troubles can be negatively affected by many things, and when your pet has digestive upset, it's a thoroughly unpleasant experience for everyone involved. The good news is that you can help your pet feel better with Hill's Prescription Diet GI Biome. It is clinically shown to help firm loose stools in 24 hours. It contains a special blend of prebiotic fibers to help support a healthy microbiome, leading to firmer stools and healthier pets. Visit your vet to learn more about how Hill's GI Biome can improve your pet's digestive well-being. Okay, and how are pets monitored during and after anesthesia?
So, in fact, monitoring starts before anesthesia already. So, on the get-go, the moment say we are preparing a pet for anesthesia, we give some what we call pre-medication. And from that point onwards, it is normal, or it's common practice to start monitoring already. So we watch how they're responding to the pre-medication. Then once we induce them for general anesthesia, we monitor. So all throughout, pre, during, and post, we always monitor things like your heart rate, your breathing rates, blood pressure. What we call SpO2, which is saturation of oxygen in the blood. Your reflexes, anesthetic depth, and any other signs. So things like temperature. How is the patient in general as well. So are they getting lighter? Are they getting too deep? We use reflexes to check all these things along with what we call basic vitals. So at the very least, your heart rate, your respiratory rate, and your body temperature, blood pressure as well. Some places will do ECGs as well. Yeah, so depends. But usually we can either manually, so a person will go there manually, use a stethoscope and count, or we use a machine to help collect all this information for us and we monitor. Depends what you have available. Yeah.
So how are they being monitored after the procedure, and usually for how long?
So once again, depends. So generally, as a rule of thumb, monitoring happens at least during the anesthesia, happens about every 5 minutes. So every 5 minutes we'll collect the measurements. Post anesthesia, before, if the animal is not sitting up yet, we will be doing it about every 5 minutes or so until the animal is kind of more conscious, sitting up, able to, at least able to stand, look around, move around. Then, okay, maybe every hour, every 2 hours, depends on the animal's condition as well. Yeah, depends. If it's otherwise quite healthy, sometimes maybe we check in every hour, if it's ready for discharge, we call the owners, that kind of thing. Yeah.
So what can pet owners do to help their pets recover better after a procedure with anesthesia?
I think the helping to recover anesthesia part should be probably done at the clinic. We shouldn't be.
So when they bring home, they are already...
Your pet should at least be conscious. Of course, there are some situations where maybe the pet is a bit more sleepy and all that. Of course, there are unique situations where sometimes no choice, But typically we will recommend, even if clinics don't offer 24-hour care, they will always recommend you to go somewhere that does, just for post-anesthesia monitoring lah. Because a lot of times the complications that happen, it's not a whole lot you can do at home lah. So it boils down to the whole the previous conversation about should pet owners be doing CPR at home? Ideally monitoring in an environment where if anything should go wrong, it can be immediately remedied lah. So what you can do is make sure you pick a place that has enough, or pick a where you can send your pet for post-op monitoring lah, if needed, post-anesthetic monitoring rather. Yeah. And then I think keeping your pet in good health, I suppose, keeping it in good health, watching their weight. Weight is quite a big, so what pet parents can do is all the basic things. Back to, I suppose, our previous talk about exotic pets, right? Everything comes down to husbandry, even for your dogs and cats. Animals that are overweight, always is a big issue with anesthesia. Underweight as well is an equally big issue. So you want to kind of find your ideal range, based on body condition score, your vet's recommendation, and all that kind of things. Making sure they get the right diet, making sure you fast them, and you're being upfront about, any conditions that they may have. Sometimes I think for pet parents, they also sometimes you feel like you need to say your pet is okay. But I think it's important to tell us when they're not lah, because then we can plan for procedures better, and I suppose in that sense you kind of help the recovery. You help the whole anesthesia process, not just the recovery lah. Anesthetic risk is not just at the post-op. Of course, we see most of our issues pre and post anesthesia. Yeah, but everything we do, we can try and help along the way, and all these the daily things make a lot of difference. It's the little things that add up lah. Yeah.
I think it brings us back to the pre-anesthetics. When you bring your pet in for the day of the procedure, to also inform your vet if you see any difference in your pets or any issues, to let them know, right? Like, because that could make a difference between your pet doing well or not for that procedure. Yeah. So, what would you tell pet parents who are afraid to bring their pets for like procedures like dental, because they are like so afraid of anesthesia? I mean, I was probably one of them last time, and like, wow, the anxiety that I had bringing my boy in for a procedure that requires anesthesia was it's crazy.
I think definitely it's a healthy fear lah. But I suppose what helped you,
what helped me was so fun fact, I actually attend the specialist diploma course that Dr. Moses is teaching with anesthesia. So after taking this course, I was in between this course lah, basically. So knowing the amount of things that the veterinary team actually takes to keep your pet safe as possible, the amount of monitoring that's done made me felt a bit more at ease. Right? Because sometimes you feel that, okay, your pet is brought into the surgery room and then they probably just stick a tube down and then hope for the best kind of thing, But then I realized that so many things are being done to monitor. On my part, I need to monitor how my pet is doing at home as well before anesthesia. And also then what the team does during. It gave me a little bit more ease. Yeah. So, but most pet parents don't take the course, right? So, yeah.
But I think in a similar vein lah, talk to your vet about it. I would say don't be completely don't close the door before you even try and walk through lah. If you've been told, okay, your pet needs a dental, it's not for fun lah. Every anesthesia is a risk. I don't think any vet goes into surgery hoping the patient dies on the table. I think it's the very last thing that we want lah. We don't even go in hoping there's a complication, and nobody wants that. And your pet, your vet is probably just as worried as you about everything going, or things that could go wrong. And your vets are definitely concerned about things going right. So we recommend things. Well, of course, everything we recommend costs money lah. But to me, or rather, when I recommend things, is because, or when we recommend things, is because we know these are things we need to know so that we can do whatever we need to do safely for your pet lah. And even if it means once we find out, for instance, say tomorrow we wanted to do the procedure, say a dental, right? But today we've done the physical exam, looks okay, but on the bloods, liver don't look very good. Kidneys don't look very good. Okay, maybe we need to step back, reevaluate, and change plan for how to manage whatever we found first, and then plan for the procedure lah. I think there is a growing specifically for dentals, there's a growing I want to say a trend of people offering anesthesia-free dentals. I think important thing is to if you are struggling to brush your dog's teeth, I don't know how they are going to do an anesthesia-free dental safely or thoroughly lah. Remember that teeth, if you scale, right, dentals are not about aesthetics. Dentals are it's like seeing your dentist. You don't see your dentist because you want nice looking teeth, right? It's not just about aesthetics. It's about making sure your teeth are healthy. Same for the dogs lah. We do dentals all under general anesthesia because we also need to assess the teeth. It's not like, oh, no tartar, no problem. Yes, it looks nice, it looks clean, but are the teeth actually attached properly? Are they healthy? Is anything broken? Does anything need to be removed? Are you sure that they can get your teeth all the way at the back? And are you 100% sure that they really didn't do they really did an anesthesia-free dental? Because I don't know. I don't offer those things because, in fact, most vets, every vet won't and shouldn't lah, because it's not safe. In fact, anesthesia is a lot safer than anesthesia-free dental lah. So I think if you have concerns, speak to your vet about them. Let them assure you. I mean, part of it, you must want to be assured lah. If you're like, no, I don't believe what, then okay lah, no one can convince you. And you must want to be convinced and allow yourself to be convinced as well. And also, I think boiling down to the previous podcast session that we had, the 3 things I would recommend pet parents is the second one, right? Find a vet you trust lah, because at the end of the day, you are going to trust your pet's life, your little fur baby's life. You're going to trust them with their life lah. And if you don't trust them, then okay lah, probably you shouldn't be doing your surgery, your procedure there. Find someone who can assure you. And okay lah, personally, I'm not offended if like my clients like, I'm not very sure, but you're like, okay lah, find someone because that's what's best for your pet. Then do it lah. If it helps you help your pet, then do it. Yeah.
Okay, great. Thank you so much, Dr. Moses, for the input. I think as pet parents, it's good to know more about things that we may be afraid for our pets. At least we make a more informed decision for our pets as well. Yeah. So thank you, Dr. Moses, and we'll see you guys at the next episode.